Welcome, everybody. We are going to go ahead and get started with our webinar. Thank you so much for joining us. We'd like to welcome you to our webinar, The Trauma, Health, and Learning Connection in Schools. We're excited you all could join us and hope that you enjoy today's webinar. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign. Healthy Schools Campaign is co-hosting today's webinar with Trust for America's Health, as part of an effort that we lead together called the Healthy Students Promising Futures Learning Collaborative. And so that the Healthy Students Promising Futures Learning Collaborative brings together cross-sector state teams working to increase access to school health services through Medicaid reimbursement. I know many of you on today's webinar are participating in the Learning Collaborative, and so thank you for joining us. But we wanted to just briefly share an overview of this effort for those of you who aren't familiar with it. The Learning Collaborative was launched in the summer of 2016, and there are 15 states participating in it that receive technical assistance and support and opportunities for peer-to-peer learning. Trauma-informed care and supports in schools is a topic that state teams participating in the Learning Collaborative has identified as a top priority in their work. We know that exposure to traumatic experiences can significantly disrupt students' ability to learn and thrive, and that schools can play a crucial role in responding to the impacts of violence, poverty, and other types of trauma students encounter. And so for today's webinar, we really want to dig into this topic and provide an overview of trauma-informed care and supports in schools. We'll highlight a state-level case study and work that's happening in California, and then want to describe and provide you all with an overview of the role that Medicaid can play in trauma-informed care reimbursement in schools. So before we get started, we did just want to quickly run through logistics for today's webinar. We will be recording today's webinar, and we'll share a link of that recording along with the slides from today's presentation through an email that you'll all receive later this week. We're going to save the last 40 minutes of the webinar for question and answer session with our speakers. But please send in those questions throughout the webinar using the questions box on your control panel. Type them in, hit send. We'll be collecting those questions and we'll get to them during our Q&A session at the very end. Next slide, please. We also wanted, next slide. We also wanted to thank our sponsors of the Healthy Students Promising Futures Learning Collaborative who are listed here. We're very grateful for their support and commitment to supporting this work and their commitment to supporting school health services for students across the country. Next slide. So just to briefly walk through our plan for today, we're going to kick things off with an introduction to trauma-informed schools and a state-level example of California's approach to this work. Then we're going to hear from our partners at Futures Without Violence, who will share an overview of trauma-informed responses in education systems and healthcare, and then wrap up with information about the role that Medicaid plays in trauma-informed care reimbursement in schools. And then finally, we will have our question and answer session at the end. So I'm now going to hand it over to my colleague, Emily Wilson from Trust for America's Health, who's going to guide us through today's webinar and introduce our speakers. So Emily, please take it away and introduce our first speaker.
Great. Thank you so much, Alex, and welcome everyone. I, as Alex said, have the honor of introducing our speakers today. And our first speaker that we will hear from is Mr. Gordon Jackson, who is the Director of Coordinated Student Support Division at the California Department of Education. Gordon is also the co-lead of our California state team in the Healthy Schools Promising Futures Learning Collaborative. Gordon, thank you so much, and please take it away.
Thank you very much, Emily. Thank you very much, Alex. Thanks for that introduction, and good afternoon, everybody. I'm happy to participate and look forward to hearing from everyone as we really, I think, launch a very important discussion about trauma-informed practices. And I think it's safe to say that many people, many educators, many community members, many parents, many people in general aren't really aware of the devastating impact that continuous trauma has on learning and living. And as busy teachers and educators are really focused on student success, there is this other piece that plays a critical role. And the more that we enhance understanding, the more we enhance awareness, the better it's going to be for all parties concerned. Next slide, please. So we know that too many of our students are exposed to trauma in a whole variety of ways. And we also know that many of our students are facing many challenges. And being encouraged to simply pull themselves up by their bootstraps can be a very damaging attitude and not helpful. We know that our students are exposed to abuse and neglect and household dysfunction, exposure to others experiencing substance abuse, witnessing domestic violence, living in poverty, and more. And when I look at this list and consider what our students are facing, it's truly with this understanding that it's not of their own volition. When I was a high school teacher, a high school principal, and I met students that were on that wayward track, I was pretty convinced they didn't wake up that morning and say, let me wreak havoc in my school. There were so many other things contributing. Next slide, please. There's also this realization that when I think about working with teachers and when I think about myself as a teacher, fully recognizing that we've moved beyond the point of looking at Alberto, one of our students, and saying, Alberto, what's wrong with you? And really recognizing that it would be more appropriate to say, Alberto, what has happened to you? And we know that there are so many classroom manifestations that are associated with trauma. The former high school teacher in me remembers quite well the disruption, the underperformance, the bullying, the overall poor attitude, combativeness and withdrawal and aggression, and just having these behaviors launched in my classroom without explanation, and me having to really tune in to the idea that although I was really focused on teaching English and teaching French, those were my subjects, and speech and drama. The other reality is I couldn't be dismissive of this behavior. I couldn't just stop and hope that it goes away. I had to be more involved in doing something to make the necessary changes. Next slide, please. We also know that it's so much more than just the classroom. That there are issues that are happening that are not just within the halls and walls of the school building. And one of those I'll use as an example is this overall concept of the school to prison pipeline. And the reality that this pipeline is a result of the disproportionate tendency of minors and young adults from disadvantaged backgrounds to become incarcerated, to have this relationship, and unfortunately not a positive one, with law enforcement. And it stems from a whole host of reasons. And we also know that when trauma-informed practices are not in place and our most vulnerable students are experiencing a whole host of things that can also be generated by racism and implicit bias. And I think it's safe to say, even though there are a lot of folks who don't like this conversation, that racism and implicit bias are real, and that not talking about the impact of certain behaviors, certain ideologies, certain thinking, not having conversations about that is not going to make this issue go away. And it's not going to be anything that's going to be helpful. Next slide. So I dig a little deeper in that because when I think about our nation's schools, and of course I can't help but think about California and the diversity that presents itself in California, that we know that there are many outside of the classroom manifestations, absolutely. And we know that the incidents fueled by racism, which is the belief in superiority of one race over another, can result in discrimination and prejudice towards students and people based on race and ethnicity, and that this is happening. And we have an example going on right now in California because of an unfortunate shooting that has really created an unsettling in our Sacramento community that's, as a foundation, has race and relationships, at the core. We recognize that incidents fueled by implicit bias, the unconscious attribution of particular qualities to a member of a certain social group, including stereotypes influenced by experience, and on and on. We know that that's real. We know that implicit bias has a damaging impact on learning and on school climate and on the health of our schools in general. And the work that we need to do to become aware of these two components, coupled with our increased desire to spread more information about trauma and enhancing awareness about trauma, are very much connected. Next slide. In California, we've reached the conclusion that we know what we know. And sometimes we educators sit together in a room and talk about research and research needs and data needs, and perhaps too often, we don't stop and say, but we know what we know, and so what are we going to actually do about that? I love Pablo Picasso's quote here that what one does is what counts, not what one had the intention of doing. And in all of the years that I've been an educator, I can just remember countless conversations where we really talked and analyzed and really dug deep. But somewhere in that whole chain of events, we perhaps diminished attention on, and so what is it that we're actually going to do? Next slide, please. We know what we know. And I will share that the California Department of Education is committed to doing. I'm happy that the leadership in my building really has an appreciation for what are going to be the artifacts, what's going to be the doing, what's going to be the evidence that we actually tackled a topic and actually did something. So today, we've got key staff members that have attended a variety of training sessions to become all the more informed. The CD took the lead role in working with California State Interagency Team, which we're very fortunate to have in California, because it does involve collaborative work with social services, corrections and rehabilitation, developmental services, healthcare services, and many other agencies that have lead people sitting together in a room saying, well, how does this impact your institution, your agency, and what is it that we can do to support one another's work? We want to continue to develop professional development opportunities in the department with a clear goal to increase the understanding of equity, cultural awareness, racism, and implicit bias. And we have to come to grips with the reality that we have much more to do. And this work isn't easy. We're not trying to make it easy, which I think is important. We're not really working to make it more palatable for our staff and to go beyond trying to have courageous conversations just to make everyone feel comfortable. I think there are a whole host of students in our schools who are not feeling comfortable for a variety of reasons. So we're trying to make it transformative, and we're trying to not lose yet another generation. And so there's a push, a sensitive push, absolutely, but there is a push. Next slide, please. So as I close, I think it's helpful to look at, the department's goals, what we're committed to, what it is that we think matters. And of course, I can think of, as an educator, 564 different things that we might be able to do to enhance the lives of our students. But at some point, we have to start with the top 10. And I would maintain that looking at trauma-informed practices is indeed one of those top 10. So we want to enhance awareness and increase understanding on the part of all involved in educating California's diverse student population of the threat to health, well-being, and success of all of our students posed by this exposure, and in many ways posed by a certain level of, I don't want to say ignorance, but for those not being aware of the impact of this exposure. We want to really change the frame so that we're identifying or developing training focused on the concept that there are no bad kids, and that adverse childhood experiences coupled with racism and implicit bias can really generate unwanted and unacceptable behavior. So much of this concern has little to do with a student's choices. They are reacting, they're responding, and they're dealing with circumstances that more often than not are beyond their control. And then looking at our efforts to connect to resources. In 2008, some of you may be aware, in 2008 we had an absolute fiscal crash in California, if not the nation, but I'm thinking of what we endured in California. But the positive offset of that is the idea that we learned all the more that we've got to work together and that we can't do this alone. And so building partnerships and cross-system collaborations to provide and develop, where needed, resources and supports is just absolutely critical. We can't do this alone. And it's the information and the intelligence and all of that collective energy that's going to make the difference. Next slide. So there is my contact information. I will say every once in a while we have to pat ourselves on the back. I will say that I'm pretty masterful at email. And so for those of you that now have this contact information and are reaching out, you are ever so welcome to do so using my email address. And I thank you for this opportunity and so much looking forward to hearing from others.
Excellent. Thank you so much, Gordon, for your talk and introduction to the trauma-informed schools, as well as a look at California's state-level approaches. I'm delighted to introduce our next speakers, who both come to us from Futures Without Violence. The first speaker that we will hear from next is Mr. Casey Corcoran, Director of Children and Youth Programs at Futures Without Violence. And then Casey will be handing it over to Lisa James, Director of Health at Futures Without Violence, as our next speaker. Thank you, Casey.
Hi, everyone. Are you able to hear me?
Yes, we can hear you. Thank you.
Great. Okay. So, hi, everybody. I'm grateful to be on, and Gordon, thank you for that fantastic overview. I also come to the work through being a former classroom teacher, and it was really what moved me into the field of violence prevention, was seeing what my students had to go through in Washington, D.C., even as 7 or 8-year-olds. Our work is around trauma-informed schools. One of our major projects has been called Changing Minds, and that is a project that came out of then Attorney General Holder's Defending Childhood initiative, looking at trauma-informed practices across communities, with schools certainly being a central piece of that, but really looking at how does a whole community look at and adopt trauma-informed practices and policies, from public education campaigns to manualized clinical interventions. And the Changing Minds Institute was developed out of this Defending Childhood initiative. And this is a two-day institute to build leadership of multidisciplinary teams from schools. So from the parent leader to the coaches, to the administrators, teachers, to the paraprofessionals, frankly, a group that we keep hearing are often left out of professional development opportunities. We developed this two-day institute, and what I'm going to share are some of the resources and some of the things that we talk about with them, and some of the approaches that we know from the field to be best practices around creating trauma-informed schools. Next slide, please. So, of course, you know, when we talk about trauma, what we're talking about is an event or events that affect a child's brain development, physical, psychological health. It can affect their whole person. And that traumatic response can really be their system being overwhelmed by that particular event. It can show up right after the event. It can show up years down the road, but it overwhelms the system. Next slide, please. It doesn't want to move slide, huh?
There you go.
And so one thing that we always like to talk about is that trauma happens and violence happens in so many different contexts. I'm a public health person. That's what I get geeked on. And, you know, for folks that know the social ecology, we know that it happens at these different layers, and that our programming has to occur at these different layers. Not that a school has to take on all of it, but it's important to know what's going on. It happens in homes, schools, community, the media, in the internet, and it's ubiquitous. It doesn't happen to just one group. Rates are different for different people, but it is not just within one group. Now, if everybody was on the phone, I would say, or if you can answer quickly, which one do you think, when you talk to the general public about children's exposure to violence, which of these do you think people most often identify, and I'll let folks just type something in there if you have a quick answer to put in the chat. Which one do you think they most identify when you talk to the general public? And I'll move on to slides, and I'll look in the chat box to see if anybody answers and go back to that. Next slide, please. So we also know that while it happens in any number of places, there are also different types: direct exposure to violence, so experiencing that violence; indirect, having it happen in your family or in your community. And then the last two, which I think, whether it be in a school or in the community, are much harder for people to think about interventions for, and those are structural and historical violence. So as Gordon said, those are things when we talk about racism, or when we talk about historical trauma, especially when futures, when we're doing work with our the Native American communities we work with, as well as the Alaskan Native communities, that there are these pieces of structural violence and historical violence that are in place, that even if we stop all of the domestic violence, even if we stop all of the community gun violence, we still have more to address in our schools and communities. And yes, somebody said the majority, Alex says the majority of people answered media. Absolutely. When I talk to people about this issue, almost everyone goes first to exposure to violent video games, which we know does affect young people. And if that's how people enter the conversation, that's great, but we need to help people understand that there are so many other types of violence that have such more profound effects on young people. Next slide, please. So we also know it's a public health epidemic. You know, in public health, we need to understand the prevalence, and we have great numbers. Well, not great numbers. We have data that give us good information. We know that 60% of children were exposed to violence in their home schools and communities, and almost 1 in 10 children saw a family member assault another family member. When we couple those with what we know about domestic violence, about community violence, this is a widespread and deep problem that's showing up in many of our schools and in our communities. Next slide, please. So what is a trauma-sensitive school? And Gordon talked a little bit about this. You know, it is that shift in language, as Gordon said, from something along the lines of what is wrong with you to what can I do for you? And I also have a colleague, Sam Simmons, who says, with the older kids, he says, what happened to you? Tell me your story. And we know that it's a process and not a program. So there are plenty of manualized programs that you can bring into school that may have a trauma-informed lens. But I think as all of us who've had to adopt the latest reading program or the latest math program in our classrooms know, it is about so much more than that manualized, shiny program. It is about a whole school and a whole community response that makes for effective work in that school. Next slide, please. And it's got to be woven into the fabric of everyday school programming. So if you have a handful of teachers that are committed to doing trauma-informed programming in their classrooms, but you have an administration that hasn't bought in, if you have family members that aren't bought in, that haven't been invited into the conversation and offered leadership opportunities, if you're not doing the work with your non-academic strategies, if your coaches in your school system are not reinforcing these messages, it's going to be a much weaker program. It has to be a holistic approach so that students have that similar experience across anybody they interact with in a school or school system. And of course, it has to be in the policies and procedures and protocols so that when new staff members are onboarded, they're aware of the culture of the school, of a culture that supports being trauma-informed and trauma-sensitive. Next slide, please. So, but we do know, while we know that almost all kids have been exposed to a traumatic event, it doesn't always lead to a trauma response. But we need to be prepared when it does lead to a trauma response. And it can, as I said, show up a couple days, a couple hours after, a couple weeks, or a couple months, or a couple years after. and it can show up in a variety of symptoms. My colleague Lisa, who talks about, you know, from a healthcare perspective, you know, often shares the different types of medical issues that often show up with individuals who've experienced trauma. Next slide, please. And it takes a lot of variables. It depends on the kid, it depends on the environment, it depends on the support systems that are in place to how a child copes with trauma, deals with it, and resolves it. I have a colleague in Milwaukee, Terry Strodoff, who runs the Alma Center, who says that trauma that isn't transformed is transferred. And I fully believe that in my work as a classroom teacher and in my work as a public health practitioner. Next slide, please. And it can show up as fright, freeze, or flee from a threat. And we often put fight first, but actually to the neurobiology folks that I talk to, it's actually the freeze that often shows up first in terms of safety. And it can be activated by a hint of danger, either real or perceived. Next slide, please. This is one I always like to include because it's not always negative reinforcement or something triggering happen, or something that we perceive as negative happening to a kid that causes them to have a trauma response or to be triggered. It can be a positive experience, praise, feeling of peace, putting your hand on someone's shoulder when you're trying to be comforting. It really is dependent on that individual child, and it can be things that we perceive as positive reinforcement that are triggering for them and evoke a reaction that we really weren't expecting. Next slide, please. And as Gordon said, we know that we know that trauma affects kids in the classroom. We have lower grades, lower expressive language, designated to special education more. It shows up in a whole variety of ways in our schools and in our classrooms. Next slide, please. So as part of the Changing Minds Institute in the overall Changing Minds campaign, we put out videos and materials which you can get at changingmindsnow.com that talks about the very concrete things that you can do as somebody who works in a school or someone who cares about a child. It can be small gestures that can have a profound effect on a young person's ability to cope, to heal, and to thrive. Next slide, please. And if you look on our website, the Changing Minds Now website, you can see, and we highlight 5 of them here: celebrating young people with compliments, comforting them by staying calm and patient, listening. That one's always hard for me as an adult. Collaborating, asking their opinions, giving them real choice, inspiring them with new ideas. And these may seem simple, but these really are some of the key tools to creating trauma-informed classrooms. It can show up in the way that you gather in the morning, whether you're doing circle time or a morning meeting. It can be on how your classroom is set up in terms of comfortable spaces or calming colors on the wall. It can be the books that are in your classroom library or that you choose to highlight as part of, or that you choose to use as part of your curriculum. Books that may that hopefully reflect the cultures and communities of the students in your classroom or the family makeup of the students in your classroom. For me as an elementary school teacher, it was having, I was able to have snacks in the room, and I had kids that were coming to school very hungry and maybe weren't making breakfast in the morning. And it can be the mindfulness exercises that you do that are simple, but help kids get re-regulated when they're dysregulated. And it can be the language that we use. You know, we talk about, it's a big difference to say, a kid comes in, doesn't have their homework, and we say to them, don't have your homework again, right? As opposed to saying, hey, I'd like to talk to you about, pulling them aside after and saying, I'd love to think with you and problem solve with you about how you can get your homework in. I want to be helpful. That is a trauma-informed practice and strategy and can make a huge difference to a young person. So the website has lots of good resources and lots of good examples of these individual 5 gestures. And I would also put out, and we'll be sure to send a link to everybody once it is live, we've been working with the Verizon Foundation as well as Discovery Education to create an online module that individuals in schools and the school community can take. It's a trauma-informed practice in schools 101, but it does give some very concrete advice, techniques, and strategies, and we will be sure to send that along. Next slide. So thank you. I'm appreciative of all the work you're doing in your schools and in your communities, and I will turn it over to my colleague, Lisa James.
Thank you. Thank you, Casey. And next slide, please. So this is Lisa James, and I, as was mentioned, I direct our health programs here at Futures Without Violence, and we've been working for the last 20 or 30 years on improving the health care response to trauma. And as part of that work, we house a health resource center specific to domestic violence, which has really expanded now to addressing all types of trauma. And so I come at this from the work that I've done in communities with healthcare providers and with community-based advocacy programs who are responding to violence and trauma, and have really seen an incredible shift in how healthcare providers are responding. And that includes healthcare providers who are working in schools. And so there's a significant shift, like we're seeing in education, in understanding the role that trauma informed care plays. And again, that impacts the work that we do in schools. And it provides a real opportunity to expand access to healing services through the reach that you all have in schools. So, but to do that, it's been really important to rethink how healthcare providers and systems understand their role and how they can address trauma. And so I'm going to share a little bit with you about some of the strategies that we've been working on. Next slide, please. So as I mentioned, there's a major shift, as you all know, around trauma-informed health services, and this is SAMHSA's the Substance Abuse and Mental Health Services Administration's view of trauma-informed health services, and it just really recognizes that there's a widespread impact of trauma, and there are paths for recovery, and that the signs and symptoms of trauma are prevalent and also involve both the systemic and the individual trauma that the person experiences. And that there's an important role to integrate the knowledge about trauma into the work that healthcare providers do and into their policies and procedures, and to really work hard when doing that to resist re-traumatization. And so Gordon and Casey talked a lot about what a trauma-informed school would look like, and we think it's really critical to include the healthcare component of that trauma-informed school. And apply these principles, these SAMHSA principles, to the work that we do. Next slide, please. And before I go there, in terms of giving some examples of what that looks like, the other reason that of course, healthcare and public health programs have been increasingly invested in responding to trauma is because of the significant health impacts. And we've been talking about the behavioral and health impacts and societal impacts of exposure to trauma, but we also are seeing some very, very significant health impacts of kids who are exposed to all types of trauma being significantly higher risk for both depression and anxiety, but also a whole host of chronic health issues, including obesity and asthma, and some of the largest health issues that our society faces in the and also these issues that you see, as Gordon talked about, there's an increased risk for experiencing these issues in marginalized communities. So the sort of overlap between health disparities and exposure to trauma is important here to understand when we look at the health consequences of exposure to trauma and understand that kind of duality of the kids that are experiencing these health issues. And I think it's just interesting to note that also children, this is a site particularly for intimate partner violence, but children of moms who are experiencing intimate partner violence are twice as likely to develop asthma. So again, healthcare providers and public health professionals are just understanding more and more that it's important to get involved in both prevention and response. Next slide, please. So when we go back to that SAMHSA framework, that we need to recognize that trauma is prevalent and that we need to offer support and harm reduction, regardless of whether or not a family member or a child discloses that they're experiencing this, and that we need to help increase safety and build resilience. And in doing that, that really helps strengthen the connectedness to the young person, to the school, and into their community. So let me say a little bit, next slide, about what that looks like for a healthcare provider. How would that change the work that they do? So recognizing that trauma is prevalent. Of course, there's oftentimes a move, particularly in the healthcare arena, to when you recognize there's a key health issue, you want to start screening for it. But we at Futures Without Violence have been increasingly aware that you need to also provide universal education about trauma to all patients or students in your health setting. And that means that you talk to everyone about the impact that trauma might have on health, and you don't only wait for someone to disclose in order to provide that important information. You also listen and are non-judgmental, and you offer information about strategies that would build resilience. And again, in doing that, you're able to strengthen the connectedness between the student and really give them a little bit of hope that there is a better future possible. So healthcare providers we've been working with in school-based health settings, we're really working with them to provide that universal education, to talk to them about the health issues that they might be experiencing and how the trauma might be impacting any kind of care plan that a provider would normally recommend, and work with them to address the experiences, normalize them to some degree, and see whether or not they can be part of the solution and work together to improve both their health and their safety, which results in improved school performance. Next slide, please. So for kids, again, kids who are getting any care in the school health systems, whether it be school nurses or psychologists or school-based health centers, they're hearing, when we make this shift, they're hearing from their health providers that they're not alone, that what they might be carrying and they might think is only happening to them, they really kind of understand that they're not alone, that it's prevalent, and that there's help available. And again, they are offered these opportunities for support and harm reduction, regardless of whether or not they open up to their provider and say what's happening to them. It's just this universal education component about trauma, its impact on health, and resources are there. And of course, when kids do open up, it's really having that healthcare provider link them up to some important services that can help them heal. And one thing I'm going to talk a little bit more about in a bit when I share some of our research that we've done in the adolescent health space is that we found that by doing this work and making the connection between trauma and health, encouraging particularly older children, adolescents, that they have an important role in terms of peer-to-peer education around particularly adolescent relationship abuse and responding to that. So I'm going to share a little bit more about that intervention in just a minute. Next slide, please. So when school health professionals really adopt this trauma-informed health services, then they are able to connect kids and families up to some really critical services. So if universal education is offered, and if, as often happens, somebody might disclose what's happening to them, or is just experiencing a number of the common health sequelae of trauma, then the healthcare providers can connect these kids and families up to a whole host of services that you see here. They can help navigate the very complicated healthcare system to try and find a medical home. They can provide and connect up with mental health and therapy. They can do some simple emotional regulation skills, but in the context of understanding what's happening in that child's life in a trauma-informed way. There's a whole host of trauma-focused cognitive behavioral theories that treatment that can happen. And again, for older youth, they can connect up with substance abuse treatment or reproductive health services that we know are in increased demand by those young people who've been exposed to trauma. So this is a really important role that school health professionals can play in making these connections to either on-site or off-site health services. And I know Lena's going to talk a little bit more about coverage of those services in just a bit. Next slide, please. I wanted to just lift up briefly that this can also impact families at large. And we've been doing a lot of work in early childhood and prenatal, perinatal, and home visitation spaces around really promoting prevention and using a two-generation approach. So working with parents, and in many, many cases, helping the parent is the best way to help the child. So there are a lot of models that exist to identify and support parents to address, for example, maternal depression and safety planning, and offering trauma-informed joint parent-child therapy through some of these two-generation approaches and family-centered services. So again, school health professionals can play an important role, and there's a couple of model programs emerging across the country around coverage for those services and new ways to make those connections through the schools. Next slide. Oh, I'll just before we go to next slide. Oh, well, it's okay. Just to note that I mentioned some of those strategies. There's a link here for a variety of different strategies to explore coverage and ways to pay for these types of two-generation approaches. And again, we'll get to that in just a little bit with Lena's talk. Next slide. So what providers can be involved in the work we do, it really is we work with primary care providers, with mental health providers, with home visitors, as I just mentioned, with adolescent health. Basically, all health providers can play this important role in a variety of different settings, and we're working across the country in community health centers and hospitals and managed care systems, and as I mentioned, also in schools. So there's some real promise in the school-based health settings. Next slide, please. And these providers, of course, exist in your schools, be it anything from school counselors or school nurses. We have a whole resource for school nurses on how to do this trauma-informed care work, to psychologists. And we've done some studies and deep work with school-based health centers. So despite the the range of services that might be available in your schools, there's some role that each one of those health professionals can play in promoting prevention and response to trauma. So next slide, please. I want to just give you an example of what that might look like in practice. And this is a study that we did in a school-based health center to address adolescent relationship abuse specifically. And we implemented this evidence-based trauma-informed approach, which I'll just briefly walk through with you, which again, the healthcare provider went through these steps, and CUES is the acronym to help them remember. They first disclosed any limits of confidentiality with the young person, and made sure to see them alone so that you're really building that trust with the young person in the health setting. They offered universal education about the connection between violence, trauma, and health, and really talked about what a healthy and unhealthy relationship looks like, just very briefly. This was a very light touch, both training and intervention, make that connection that we're talking to all of our patients about how relationships might impact health because it's such an important and critical issue. They offered them through that universal education. You see a picture here on the slide of a card, a hanging out and hooking up card that talks about relationship abuse and its impact on health, and it also has panels on healthy and unhealthy relationships. And they offered 2 cards so that the peer, or more, if the young person asked for more, so that they could share them with friends or family members who might need it. And again, this gets at this move away from disclosure-driven practice so that you're really empowering the student to share that information and to see themselves as an agent of change in addressing teen dating violence. And then it walked through a number of harm reduction strategies, which are really looking at and addressing health issues that are impacted by, in this case, relationship abuse. And where people did disclose, offering a warm referral to a community-based program and following up at the next appointment, if there was a next appointment with the young person. So next slide, please. I share that example with you to give you a sense of what does this really look like in practice, and also to say that we're really finding some incredible results through programs like this. So after this very brief training and intervention was put into place, we saw a significant decrease in both textual harassment, and so the cyberbullying that we're seeing so much in schools. We also saw a decrease in reproductive coercion, and that's just how a young person might be experiencing an element of an abusive relationship, which a person's trying to get them pregnant when they don't want to be, and the intervention addressed that, and we saw a significant decrease in the teen and young adult health center site. And the students were overwhelmingly positive about the information that was provided, and I was encouraged because the vast majority of them said that they would bring a friend to the health center if they were experiencing an unhealthy relationship. So again, just lifting up that it's really important to do the work, that it makes an impact on both health and safety, and that it increases that connectedness with students to the health center and the school, which we know in and of itself is trauma treatment. Next slide, please. So all of those principles and the elements of the intervention that I just shared kind of help support these key principles, again, going back to SAMHSA's approach to trauma-informed care. And I just leave you with these key principles of promoting safety and trustworthiness and transparency. And I think by normalizing the conversations in health centers, you do that. By encouraging peer support, again, by offering resources that can be shared with friends or family members. We've really heard from young people that in and of itself was very transformative for them and a big part of their healing. Collaboration and working with the the services off-site of the health center, and again, empowerment, voice, and choice. And all of that done in the context of understanding the elements that contribute to violence and trauma from a cultural, historical, and gender framework. So with that, next slide, please. I will turn it to Lena and just say that we've been working not only at the individual health center level, but also at the policy level. And there's a whole host of recommendations in this policy guide that you see on our slide around how to encourage trauma-informed schools. And there's a lot of recommendations there. So if you click on that link, and you'll be able to, again, access some best practices at the state level and at the local level. To work not only in the individual school or community, but also at the state level. So with that, I'll just end by saying, as I turn it over to Lena, that all of the resources and practices that I just mentioned, you can find tools and resources for your healthcare providers. They're available free of charge through Futures Without Violence and our National Health Resource Center on trauma. And so all of that can be sent in. Please do contact me if you have any questions. Thank you.
Thank you so much, Lisa. This is Emily Wilson from Trust for America's Health. Thank you and Casey Corcoran both so much for your presentations and for that look at the trauma care response in schools and in the healthcare system. I just want to, as Lisa mentioned, hand it over next to our next speaker and presenter, Lena O'Rourke, who is the principal and founder of O'Rourke Health Policy Strategies. And Lena is going to take us through the Medicaid perspective on trauma-informed school services. Thank you, Lena.
Emily. Next slide, please. So my job today in playing cleanup is to talk a little bit about how we can begin to bring these services into schools. And it specifically to ask a question that I'm sure everyone is thinking, well, how can we pay for this? And so my job is to talk about Medicaid. And more importantly, to talk about how Medicaid thinks about trauma-informed services, and specifically the ways that states and schools can leverage Medicaid's unique benefit package for kids to support the delivery of trauma-informed care in schools. And here's the bottom line. Medicaid covers services that are trauma-informed. It covers health and behavioral health services that are trauma-informed. And to make that point in writing, the United States Department of Health and Human Services put out a letter on this in July of 2013. Next slide. This letter acknowledges that there isn't a code for an ICD code or a DSM code for trauma effects. But what it says, and I quote, trauma-related symptoms are identifiable and can be clinically significant and can be addressed with appropriate interventions. For these children, appropriate screening, assessments, and referrals to evidence-based practices are clearly indicated, end quote. And the letter goes on to talk about, among other things, that the fact that medically necessary trauma-informed services are covered for children. Next slide. The services are covered through the EPSDT benefit, which for those of you who participate in our learning collaborative, you've heard of this before. EPSDT is a guaranteed benefit for Medicaid enrolled children under the age of 21. And it covers lots of services for kids, even if those services aren't typically covered by Medicaid. And for our purposes here today, it can cover comprehensive health and developmental history. It can cover diagnostic services and assessments, health education, including child development and accident and disease prevention, treatment of all physical and mental illness or conditions, and other services that are found to be needed, regardless of whether that service is covered by Medicaid's state plan or not. Next slide, please. And so, what's the takeaway here? The takeaway is that Medicaid covers trauma-informed services for kids. And states then have the ability to use Medicaid to increase access to these school-based health services, which means that there may be opportunities here to increase Medicaid-funded trauma-informed services in schools. Now, this isn't everything that we have talked about today, but it can be an important first step towards increasing access for students. Medicaid funding, as the participants in the Learning Collaborative will know, can add additional resources to increase the services. And it can also really encourage new thinking about how schools and healthcare entities can work together to support children who are experiencing trauma. And states have lots of opportunities to think about how to bring Medicaid into the schools. And we already have a good service delivery system in place in schools, including the school nurses and counselors, the school psychologists and social workers. So we are building on this strong foundation to look at Medicaid, to see where it is, and then to use it and to leverage it to influence the trauma-informed care system. So one very concrete way to think about this in the Medicaid context is if your school, your state, and your system could increase access to behavioral health services and other services by utilizing the change in policy in the Medicaid free care rule so that you could seek reimbursement for all Medicaid enrolled students, not just those who have medical services in their IEPs. That's one way to think about bringing in Medicaid reimbursement for a broader group of students. Also, providing evidence-based trauma-informed interventions, like Lisa had talked about, into the school-based health settings through policies to expand the services and types of providers could be a way to really think about Medicaid. Similarly, thinking about using Medicaid to bring together new partnerships with local health delivery systems, FQHCs, and school-based health centers. All of these ways of thinking, which we've explored a bit through the collaborative, are ways to leverage Medicaid for health services, but can be layered upon the trauma-informed care system. Next slide. So to do this, to work through Medicaid, I encourage you to keep doing what you're doing and thinking in a cross-sectoral way between education and Medicaid. First, you need to build your case. You need to identify the services that are needed, who needs them, and what your existing capacity is, and where the capacity may fall short, and where Medicaid can help fill those gaps. And certainly, using available data and using available case studies, you can really build your case for how to build your trauma-informed system in the school, but also the very important role Medicaid can play in bringing in funds for those Medicaid enrolled students. Next slide, please. You can look, and in fact should look, at funding sources across all programs, including those inside your community, and how to build Medicaid partnerships with providers outside the school wall. Looking for those opportunities to blend and braid funding will help with startup costs as well, as Medicaid doesn't often pay for the investment, but could become a sustainable resource as reimbursements go once the programs have stood up. So you need to look at all these pieces of it. Next slide. And for those of you who are in state government and state policies, including those of you who are in the Learning Collaborative with us, there's a very strong role for state policy here, and how state policy can both play a role in invigorating the conversation at the district level, in creating a statewide responsiveness and interest in trauma-informed policies, but it can also be really concrete in terms of developing state guidance. Like the federal government did, a similar version could be available at the state level. Promoting best practices in early identification and screening and assessment, and policies to support and educate the local education agencies on both how to integrate trauma-informed care, but also the role that Medicaid can play in paying for that care. So lots of opportunities, lots of ways to think about bringing Medicaid into the school systems to invigorate change, to pay for services. Which I'm happy to dive in deeper, but again, the takeaway from this part of the presentation is just to really think of Medicaid as a really important partner in building out health and behavioral health services to address trauma, or to address and to heal students who have experienced trauma in the schools, because Medicaid does pay for these services. With that, Emily, I'll turn it back to you.
Great, thanks, Lena. Thank you for that excellent presentation and a look at Medicaid. I think based upon some of the great questions that we're getting, it does look like folks would appreciate maybe a little deeper of a dive, so we will definitely get to those. And with that, I would like to again thank all of our speakers that we've heard from over the past hour for their excellent presentations and all of the time that they spent and investment putting together this webinar. And I'm going to launch us right into the Q&A session because we have about 30 minutes left. As I mentioned, we've been getting a whole host of questions about the presentations, so I will read them aloud and ask speakers to respond in the order in which we receive them. And we also will have a record of questions if we don't get to yours today, because this is a very rich group with a lot of questions, which is wonderful. We will definitely connect with you and find ways to get you the resources that you've been asking for, so please rest assured. I'll also mention, just as another logistics note, that we will be making, as Alex said at the top of the hour when we started the webinar, the recording and slides available to people after we're done here today. Okay, so our first question comes in about community partners and the school to prison pipeline that Gordon talked about during his presentation. So the question is there data to show community partners to share with community partners the numbers behind the school to prison pipeline. So Gordon, I think this question was asked of and shared during your presentation, and if you don't mind, I'll start with you, and then also I'll ask other team members, and I'll be chiming in as well with additional resources for these questions. So Gordon, would you mind starting if you have any response to that in terms of any data that might be helpful to share around the school to prison pipeline?
I do, and in fact, it's a great question, and I'm happy to report that I've been working closely with California's Chief Justice, who's taken a great interest in this and started a steering committee on keeping kids out of prison and in schools. And so there is data, maybe limited and of course not as broad or as expansive as we would like, but I think we do have a view of the problem with some data. And I'm thinking at this point, because I don't have that in my head, that I would happily collect some of that in a real kind of easy to follow, presentable format to give to the organizers, so as they create the package that people are going to have access to, you'll have that information as well. So I'm making myself a note to provide that.
That sounds wonderful. Thank you so much, Gordon. And I would just add to that, this is Emily Wilson again from the Trust for America's Health and the Learning Collaborative. I would just add to that if folks are interested in looking at some more of the national data that's been shared around the school to prison pipeline, both for girls and boys in terms of the broad youth picture, there are several organizations that have done a tremendous amount of work on this over the past several years. One of them is the Georgetown Law Center for Poverty and Inequality. One is the American Bar Association, and one is the Vera Institute for Justice. So those are all national level policy organizations that do research and policy analysis on the school to prison pipeline. And I would also mention our partner for this webinar, Futures Without Violence, has done, I believe, some policy briefs and webinars as well on this issue. So there's a host of information out there, and we will certainly collect the resources that Gordon mentioned. Thank you for sharing those and get them out to everybody. Does anyone else from either the speakers or the Learning Collaborative team have anything else to add about this question? Okay, great. Thank you so much. Well, we will pass along those resources as I mentioned. So our next question is, what are schools doing to help teachers understand the impact of their own ACEs? And I believe that this came up during Casey's presentation. Both Gordon and Lisa, if you have any thoughts that you'd like to share about this, that would be great. And we can also circle back and get some resources with regard to this question out after the webinar as well.
Gordon, do you want to go first, or do you want me to respond?
You could respond first, sure.
Okay, this is Lisa. It's a great question, and definitely we have a number of resources that are available. In fact, anytime we go into a school or in my work into a healthcare training or public health initiative, we do always start with staff's own exposure to trauma. And it used to be that we would do sort of training on how to respond to kids or patients and then end with the, this might have happened to you as well, but we now have just learned it's so important to start there. It's not, this is a problem that is so prevalent that it's going to be prevalent among your teachers as well. So there are a whole host of resources that can help teachers and healthcare providers think about their own exposure to trauma as a child or currently. Also think about the impact that vicarious trauma has on them and how it might be impacting the way that they interact with students and or patients, and to just walk through some very simple and in fact basic ways to take care of yourself in the moment, and of course referrals to more comprehensive services if that's needed. So definitely, actually after the webinar, I'll send over a couple links to our Workplace Resource Center on Violence and a link to our vicarious trauma resources for school health professionals.
And thank you for the question, and that's a great response, Lisa. The only thing that I might add is that your question, of course, reminds me of just all the work that we have to do to enhance understanding about trauma so that it matters. Because in a state like California with 10,500 schools and 1,112 districts, with a real strong emphasis on local control, that oftentimes it just depends on the leadership of that site, the leadership of that district, how much they connect to this. And yet there could be, by virtue of zip code, another place within the state that is not tuning into this and not seeing this as a critical need. So in many ways, there's a great desire to just calibrate understanding that this is not optional. It's an absolute need, although there are no mandates that we're providing here and now, but to really get people to climb, on this train with the full recognition that in many ways this is the low-hanging fruit. When you talk about academic success, this is something that's so highly doable, as shared by my co-presenters who provided just a plethora of good information.
And one other thought I just failed to mention is that when you're thinking through new policies, new school policies that are comprehensive, it just is really important. I'm so glad the question was raised to think about what are the policies going to be for staff and for teachers, and also what are the supports. And again, we have some sample policies that can help guide that practice at the individual and community level, but that each school takes into consideration, not only from an individual and sort of supervisor role, but also in their policies to address and support the teachers and their own exposure to trauma.
Somehow there's this full understanding. My last comment is that there's this full understanding as we're enhancing this awareness is also being mindful of not re-traumatizing. And that's, I think, is a critical piece, which is, I agree completely, looking at the needs of our teaching staff and how this is impacting them.
Mm-hmm. Excellent. Thank you both so much for all those thoughtful responses and resources that we can share. I also wanted to just add that there is an excellent site called acesconnection.com, which is a really sort of a social networking site, but it's a community of practice site. It is supported by the Robert Wood Johnson Foundation, and it is a space for activists, teachers, health practitioners, parents, community members to really share information and resources and even some support with each other around the trauma, health, and learning connection and related topics. There's also a specific sub-community within that site for ACEs in education. And so there's folks sharing resources on that site from within K through 12, from within colleges and universities, and even among graduate students. So it really is a wonderful resource. And I would just add that that is a place where we see teachers being very active in terms of sharing information on ACEs and looking for support within their own communities. Great. So our next question comes in and is sort of a two-part question, and it looks like it was directed at our second speaker, Casey Corcoran, who did need to step off. So I will ask Lisa and Gordon to respond if you don't mind again. But this question really focuses on giving specific examples of non-academic strategies for a whole school approach, and also maybe talking a little bit about the challenges and barriers that are associated with bringing trauma-informed supports into schools, but not having a whole lot of time, not having trainings up and running for teachers on these topics as we were just talking about, et cetera. So I know that's sort of a two-piece question and there's some complexity in there, but I'm wondering if Gordon and Lisa, you have thoughts that you'd like to share on those pieces.
Be my guest, Lisa.
Oh, you go first this time.
Okay. I'm thinking that in terms of non-academic supports, one of the things, and as you're listening to all of this information and becoming all the more aware about what is available, so it really isn't perhaps a lack of resources or a lack of what to do. I think it's helpful that there is the time spent at a school site in particular with kind of methodically designing a plan. And it may be a plan as simple as, in terms of non-academic, how students are greeted, how teachers, in the Central Valley, there's a great program called Handle with Care that I think came from back east when a student has had a horrible experience at home, domestic violence or whatever on a Tuesday night. The police were called out. during the night, there's an email that's sent to a contact at that school that says, Pedro had a really bad experience last night, a very traumatizing, handle with care. So that means that that teacher is aware, and everyone is aware, to greet him, to celebrate him, and to help him through this transition. So there are a number of ways of using some of these resources and fully recognizing that, again, as I said earlier, here are the 10 things that we're going to do at our site that are in support of trauma-informed practices, with also the work that's done as a team to help the teaching staff recognize that it may seem as if you're being asked to do yet one more thing, but in reality, this has a huge impact on your classroom and school climate, to the point that classroom disruptions and behavior issues are diminished. So it's kind of in your interest to work together to really look at 10 ways as a start that we can address this.
Mm-hmm. And I would just add that if you haven't already, it is worth going, I think, to the website that Casey, my colleague Casey, talked about, changingmindsnow.org. There are a number of tools and resources that are easy to implement, and in fact, the gestures that can heal that he talked about are perfect examples of non-academic responses, and so much so that sometimes when we present them, people say, "Oh, well, I do that already." Things like celebrate, how to use put-ups and not put-downs, and how to comfort and stay calm and present and patient with the student, and how to listen and show an interest in their passions, and how to collaborate with them and really ask them for their opinions. But these gestures or everyday things that you can do to help a student, if you do it and you come to that with the understanding of what they might be going through and the impact of trauma that they might be going to is having on them, and again, kind of apply these gestures in a trauma-informed way, it really has been shown to make a difference in the lives of students and their families. So do check out that website. It has more information, and it has a number of other resources that are available for you all to just pursue at the individual level, at a school level, and then to think through how, as Lena talked about, how to kind of make this policy and practice at a systems and multi-system and multi-sectoral level as well. That's changingmindsnow.org. It also includes some videos that are helpful for a training perspective if you want to introduce these concepts with peers and so forth.
Thank you, Lisa, and thank you, Gordon, both for your responses to that two-part question. Great question, and we will definitely include all of the fantastic resources. I'm making a note that we've heard about today. So our next question, a little bit further down the line, is specifically asking what is meant by the limits of confidentiality. And I believe that this might be relating to your presentation specifically, Lisa, or possibly Casey's, and it may sort of focus on FERPA and HIPAA. So if you wouldn't mind starting us off there, that would be great.
Yes, yeah, that's probably me. And I know I just rambled through that intervention very quickly. But within the healthcare context, in particular, when you think about what's reportable, if a student discloses, that changes from state to state, and also changes based on age, and in fact changes a little bit based on how each community implements local laws. So the main thing to remember is, first of all, understand what the context is in your local level, and then understand what any reporting requirements are, and disclose those limits to the young person prior to any conversation about trauma that might be reportable. So this is another reason why we at Futures Without Violence have sort of shifted away from screening alone and having this more universal conversation about the impact that trauma might have on health, and how that there's resources available, but doing that in the context of building trust and letting that young person know that if you tell me that somebody, for example, is trying to hurt you or you're trying to hurt somebody, that might be reportable. So just letting them know what you are required to report, and that really does depend on your region. And we at Futures have a number of resources that summarize the reporting requirements, particularly to intimate partner violence. And Lena, I know you've been digging deep into the HIPAA FERPA world, so you might have more to say around that, or you might not, in terms of any limits of confidentiality there.
This is Lena. There's a lot to say, I think, about HIPAA and FERPA, and I think there's a lot of misunderstandings about it. I think what's important for this group on the phone to know, and we've unpacked it in a lot of different contexts in a lot of different ways, is that the rules are there to help protect patient confidentiality, but there are also ways that become important to share the data across health systems and providers. And that can be done well and with care, and being thoughtful and deliberate about the sharing of data is important. It's a little different than the disclosing the limits of confidentiality that Lisa's talking about. And given a lot of questions and limited time, I'm going to just put a pin in HIPAA and FERPA. We can talk about it another time more, because I think there's a lot to be said about it in this context, but I want to keep a little more focused. I just don't want to go down that rabbit hole right now.
Yep. Fair enough.
Yes. Yeah. Thank you, Lena. Much appreciated. And we also have some resources we can make available on that as well, going beyond sort of some of the issues that Lisa mentioned, so comprehensively, and looking at HIPAA and FERPA. So we will definitely include those too. Thank you. So thanks to you both. Our next question is whether there has been any work done with college students. And so I know Futures has done a tremendous amount of work with college students. And again, the scope of this webinar is really focused towards our learning collaborative, which includes school districts and departments of education really focused on early childhood and K through 12. So I don't want to take us too far in that direction, but I will absolutely make sure that we include some resources that that direct the needs of that population too, if that sounds good. And maybe we can move to the next question after this, if that's okay. So our next question after that, it asks about medical necessity. And so I think, again, Lisa, this and Lena relate to your presentation specifically. The question says, in order to get resources, there first needs to be identification of medical need to provide trauma-related services. So how is medical necessity met for these services? How is it established? Lisa, do you mind taking that first?
Sure. I can start, and Lena, if you have anything to add. Yeah, so as I mentioned, again, very briefly in the beginning, there is so often a whole host of negative health consequences of trauma. So any of the school psychologists, nurses, or school health settings that are either on the phone or who we work with can definitely attest to is you're just seeing very high rates of students with trauma coming in because of the health consequences that we know are so prevalent. So that necessity just is there, unfortunately, because of those high rates of the sequelae that's associated with trauma. And then, Lena, I don't know if you want to say a little bit more. You were talking about if you establish that need, then you can use it for all students in terms of Medicaid coverage, but definitely in terms of services in the health setting, you're just unfortunately seeing a lot of health consequences that are trauma related. So that wouldn't be a particular challenge.
So this is Lena. I'm going to address this from a billing and reimbursement standpoint. And it's a tricky question, in part because Medicaid does exist differently in every state, and medical necessity definitions will vary by state. And how you document and prove medical necessity may vary based on the health plan. If the kid's enrolled in a managed care plan, what that process looks like can be really different. And so the underlying question is, do you need in order to be able to provide trauma-informed services, they need to be medically necessary. So how do you say that they're medically necessary? And the actual sort of documentation of that will vary by state. Which is not a satisfying answer, I know, but I think maybe the way to approach that is to think about the questions to ask at the state level, to think about, for those of you involved in state government, particularly in the Medicaid folks, how you could help explain what that process looks like to schools so they understand the guardrails in thinking about medical necessity. You know, similarly, I think asking questions and building strong partnerships with managed care organizations adds a real layer of transparency on what that process looks like, and what the documentation will look like. And building out at the local education agency level and at the state level what those processes are and what best practices are for talking about medical necessity in a trauma-informed context will be really important, and not necessarily easy, but good conversations to have. The other thing I do just want to touch briefly on is that increasingly states and policymakers and advocates are really thinking about how to, this is not really answering the medical necessity question, but it's not unrelated, look at broader systems of prevention, and to Lisa's point about two-generation solutions, looking at ways to serve families who have been impacted by violence, experiencing the symptoms of trauma, how to do early intervention, do prevention services under Medicaid, and to really transform the system of care so that you're able to intervene earlier, and to help prevent some of the longer-term symptoms of trauma from manifesting. And so it's a different path and process than intervening in a more acute setting where it's a little more straightforward to think about medical necessity. But as those systems evolve, state policy and state advocates can really ask questions about how to implement those pieces too, and how to really think about prevention strategies in the Medicaid context in schools, and how to work within the confines of medically necessary to promote the kinds of care and services that we know are necessary, not only to heal, but to really do prevention in the short and the long term.
Great. Thank you so much, Lena and Lisa, for your response to that. Our next question, and this may be, I think we have room for this one and maybe our next one in the last few minutes that we have for the webinar, is from a state representative, from a state health representative who is in a non-Medicaid expansion state. And they were wondering, in such a state with poorly funded schools, how can health and faith-based agencies assist schools with their trauma-informed care services? So I think there may be several people that have thoughts on this, and I might throw it back to Gordon, if you don't mind, to just kind of ask you if you have experience with that, just in terms of working with outside partners, maybe health and faith-based agencies in California, or if anyone else wants to take up that question.
Yeah, I don't have, we're somewhat still in our infancy as the State Department really dialing into this, so I don't really have anything to share in response to that question.
Okay, great, thank you. Lisa or Lena?
This is Lena, I'll jump in. So I want to unpack that a tiny bit. First, let me deal with the non-Medicaid expansion piece, because I want to acknowledge and really honor what a tough situation it is to serve families when coverage is not always available for the parents. And given the link between parental coverage and child coverage and the positive association when you cover parents on getting kids insured, I know the politics and the actual real life impacts of those choices, those state policy choices can make a really tough Medicaid environment, and I don't want to minimize that. However, what I will say is, based on our experience in particular with this learning collaborative, many of the states who are in states without the Medicaid expansion, I think there is a tremendous amount of opportunity to work in a cross-sector way to look at schools as an important part of the delivery system for kids. And this is true across all issue areas, not just trauma-informed care, but I think it holds a particular relevance for this conversation in this webinar, that working together, Medicaid and schools and outside partners like health systems, like the FQHCs, the health centers, hospitals, and other community-based health systems, working together, it is really still possible, even in a state with a tough Medicaid environment, to have this conversation about making sure kids have access to coverage and care. And that the locus of that, where it starts, seems to vary from state to state, but states are having a really good, this stuff is moving. These conversations are happening, and to use Gordon's words, it's still in its infancy, but learning to talk across the sectors and with the community-based providers has offered the states we have worked with through the Healthy Students Promising Futures Learning Collaborative an opportunity to have those conversations in a structured way and to figure out what questions need to be asked, because somebody at the state has those answers. And, in thinking about resources and workplace and the workforce, thinking about how schools partner outside the school walls has really yielded policy transformation, while nascent, that has the ability to integrate these trauma-informed delivery systems into schools, and schools where there is interest and support are able to receive the healthcare service as part of their system delivery to implement trauma-informed schools. And so there's a lot that can be done. It takes persistence and will and time, but there really is a there. And I think it's important to really seize this moment in time and to work on it.
Excellent. Thank you so much, Lena, for that response. And there are definitely, in support of everything Lena just mentioned, some resources that we can share around that as well, because it is an issue that I think is, as Lena mentioned, is incredibly relevant to our state teams and folks on this call, on this webinar. So with that, unfortunately, we are out of time. That looked like the last question that we have time for today. We do have several more. So as I mentioned, we will definitely work on getting responses and resources out as soon as possible to everyone to make sure that we close the loop on outstanding questions. And as I mentioned, we'll also be sending the materials from today's webinar. We just want to quickly thank again everyone for joining us, and especially our sponsors and our speakers today, Gordon Jackson, Casey Corcoran, Lisa James, and Lena O'Rourke. Thank you all so much for your time and investment, and thanks to the Learning Collaborative and all of our other partners who joined us today. We really appreciate your time and look forward to continued learning in this space.
Thank you.
Thank you, everyone. Take care.